Hi there. It's been a busy year for everybody. It's been a busy year for me as Minister for Health, and I wanted to take this opportunity a year in to just provide you with an update on the progress that's been made in healthcare. Yes, the year has been dominated by COVID, focusing on public health measures, testing and tracing, treating people, nursing homes, quarantine, and a lot more. Our vaccination programme, it's fair to say, is the envy of Europe. People getting vaccinated as quickly as supplies arrive. Nearly 4 million doses have now been administered, which is phenomenal. But there's also been a lot of other things happening with the biggest budget ever this year, more than €21 billion, which is helping us make things better for patients and better for their families. We're funding 2,600 more beds in our hospitals and in our communities. We've the money to hire 16,000 more staff in the health system right around the country. COVID should have made the winter trolley crisis much worse, but thanks to a €600 million winter plan and amazing work by our healthcare professionals, we actually had the lowest trolley numbers on record. We've agreed a really important new deal for consultant-led public health. We're making things better for patients by fully funding strategies in cancer care, trauma, maternity care, mental health, and a lot more. We've the biggest ever investment in disability services so we can help people with disabilities, children and adults. Patients can access more potentially life-saving drugs. Greater access to medical cards for the terminally ill has been possible as well. The incredible hospices around Ireland have been supported more than ever so they can take more and better care of people. I believe a revolution is needed in women's healthcare. We're off to a good start, including a specialist centre for endometriosis, gynaecology clinics, fertility hubs, lactation consultants, and we're working with the amazing Women's Health Task Force on much more, including menopause, mental health, wellness and other issues. We're also prioritising waiting lists. There have been some early successes, like in assessment of need for children with disabilities. There's a huge amount to do, so I'll shortly be sharing a plan because it's simply not okay that people are waiting years to access healthcare in our country. Thanks for watching, and I'll update you again soon.